Welcome back to Great Day at 9A. We talked about earlier this week on Great Day at 9A about this, but Tuesday was World Mental Health Day. Now, mental health has been a growing issue, especially after the pandemic. I think the pandemic really brought it to light more so.
100%. In our state, there are now places you can go to get mental health help that do not mean a trip to the emergency room. Psychologist Dr. Saunders is here to tell us about the behavioral health urgent care centers. Good morning, Doc. How are you?
I am well. Hello, friends. Happy Thursday. And yes, I am here to highlight and these urgent behavioral health urgent care centers.
There are 4 of them. Is that correct?
There are 4 of them. And I think it's really important to note that while we talk, in our segments here on ways to improve mental health and ways to do things to help yourself feel better, sometimes things get out of control.
Yeah.
And if you have a child or a teen who has more serious mental health difficulties or is going through a serious mental health crisis, and by that we mean, self-injury or suicidal thoughts or suicidal behavior, severe depression, severe anxiety, there are places to go now in this state so we don't have to go to the emergency room because the emergency rooms gets very backed up. There's 4 now in the state. And 1 located here in Hartford at the Village for Families and Children, but there's 3 others all around the state.
And these are walk-in clinics, right, Doc?
Yes, they're walk-in clinics in the same way that an urgent care center is designed. So it's meant, as I said, it's meant for more severe mental health crises, and you can just walk into these centers. They have the capacity to do an assessment, to help you with treatment planning, to make what we call placement decisions. Can we just kind of solve the problem here and send you back home, or do you need a higher level of care? So they can make these decisions. And again, it's meant to divert people away from the emergency rooms when, they just don't have the resources to deal with a lot of severe behavioral health crises.
And we just want to run by really quick with the audience where these 4 are located. We have the Village for Families and Children in Hartford, Yale New Haven Hospital in New Haven, the Child and Family Agency of Southeastern Connecticut in New London, and Wellmore Behavioral Health in Waterbury.
Yes, and it's really, really important to know that, while we need to do things each day to help ourselves feel better, as I said, sometimes things spin out of control. We've talked on this segment about 988, right? That's kind of like a crisis or suicide hotline as opposed to 911. There are resources. There's 211, which is info line, but now 211 can actually send you to these urgent care behavioral health centers as a way to avert the emergency room. Because if you were in a severe crisis, 211 would just send you to the emergency room. But this is a way to avert going to the emergency room.
I think we all want to know, who's staffing these centers, Doc? Are they clinical psychologists, or do you know anything about that?
So, this is funding that came through the state of Connecticut. So these centers are funded by licensed mental health clinicians. They would have psychiatrists, psychologists, clinical social workers, and they would have individuals that have skills in doing assessment during a crisis, and then the help with some of the case management and connection part, because it's not just assessing the crisis, it's what are we going to do next?
Right.
What are some of the next steps? And they can help with that as well.
And these are resources that are made available as well. If school community, for example, experiences a crisis, we had the Windsor High School, they just lost one of their football players. And, these crisis teams, they come in, these grief counselors. Is it similar to that kind of work as well?
Yes, those kind of situations are very contextual, right? You want to bring people into the school setting. This is for individuals who are, could be in school or at their homes, having a very severe, really often life-threatening mental health crisis, and they need a professional assessment. And so it's bringing them to a place where they have mental health professionals ready to do those assessments and put a plan of care together.
All right, we have to go to, in about 30 seconds, but really quick, Doc, just while we have you here, with everything going on, I mean, here in Connecticut, we're dealing with the 1-year anniversary of the 2 police officers that died in Bristol, to globally, what's going on in the Middle East right now. Do you have any top 3 points of advice for any parents for their kids and how to kind of navigate this?
Yes, when possible, shield your young children from information that is upsetting or distressing that they have no control over. Another thing would be have appropriate developmental age conversations with them if they have questions. And the guideline is just answer their questions. Don't give them extra inflammatory information.
Oh, that's good advice.
Okay.
Oh, that's really good advice. Thanks you, Doc.
Doctor. We always appreciate your help. We'll see you next week.
Have a great day.
You too.
You too.